Good.
Oh.
Great release on that
God. Yeah, that's what I came here for.
And I think I was looking at your chart. You're a massage therapist, is that right?
Yes.
Yeah, very cool. I was a massage therapist for 13 years before chiropractic, so
Nice.
I know.
I instruct as well.
Oh, very cool. Yeah, I used to teach at the schools too. So you teach mostly in Houston, is that right?
Mm-hmm.
Very cool. Cool. Okay, so we've been having maybe some neck and upper back stuff and some jaw stuff. Is that right? Okay, talk to me
And
about it.
sometimes I dance a lot too, so sometimes my knees every now and then and my hips. Like
Okay.
this hip has been bothering me. But I was in a car accident about 4 years ago, and I had a herniation in, I don't know if it was C5 or in C6, and then L5S1. I did get the steroid injections. I don't really have any pain from that, but I just noticed after the accident, this part of my jaw like goes out, and this side doesn't. So the left side, I don't get any pain or clicking. I just have always like tension here. Like I get, and I think it's causing my neck to always be like tight too.
Okay.
But
Do you think that you're clenching or grinding at night at all?
I don't grind. I might be clenching.
Okay.
For sure. But just up here, and I do feel sometimes like compressed, or concaved in, probably from massaging. And,
That gives you kind of like achy discomfort in the upper back and neck. Okay. Well, let's take a look at your neck, back, everything first. Then we'll probably finish up with the jaw. Things tend to go smoother that way. But you're in the right place. The jaw is what I specialize in, along with the neck and upper back. So we'll kind of go from there. So I'll have you take off your glasses. Yeah. And then you'll come around here, just have a seat facing the wall. All right, let's see how well we're moving here. Yeah. Yeah, so we're pretty tight in that lower neck. We got some rib stuff going on too. Okay, so the neck is as good a place as any to start. So I'm gonna hop up here with you. I'll just have you lean back on my leg. I'm gonna kind of hug your head. Good. I'm gonna turn you and make sure that's leaning on me. Yeah, perfect. Good. Doing okay? Mm-hmm. All right. Good. Okay. Still alive?
Mm-hmm. I felt that in my head.
Love you. Lay on your back now. I'm going to cross these arms. Okay, big breath. Out. Good. Ooh. One more. Good.
Oh. Yeah.
Those were deep.
Yeah. I felt that in my stomach.
Yeah. Okay. Let's have you lay on your side. You're going to face me over here. Scoot back just a little. Yeah. This arm will go up. Good. Oh yeah, your sacrum was super tight. Good. Other side. Good. Good. Okay, how are we feeling?
Good.
So now we're going to decompress your hips. Good. Wow. That was loud. And then since you're a massage therapist, we'll do your wrists and hands. I know how important this is. Good. Okay.
Ooh.
Wow. Good. Okay. Now let's scoot you up here towards the top. And we'll take a look at the jaw. Way up here with your head on the pillow. Perfect. Okay. So, open, close, open, Close. Yeah, we're getting a lot of deviation where this is sliding out to the side. So just kind of loose for me. Yeah. Okay, so we're going to get in here and work on this. So we're going to turn you to the side. Perfect. So you want your teeth just slightly apart, as loose as you can with the jaw. It's going to be kind of just a quick motion. Good. Doing okay there? Mm-hmm. Okay. We're going to do the other side. Loose.
Oh,
great release
my
on that
God. Yeah, that's what I came here for.
Now, we're going to try one more for this side, okay? So,
sheesh.
I'm going to lift you up. This one's going to be slightly different.
Okay.
Still just loose as you can here.
Oh, wow. Yeah.
So we got it. Good to, you're welcome. You're welcome. We're going to rough you up a little bit to get that right side.
Yeah.
And then let's just give you a good decompression here. So we're going to have you lift that head up. And then we're going to set it down. Perfect. So for this one, you just want your teeth touching so you don't chomp your tongue or nothing. You're going to breathe through your nose. You're going to feel a gradual pull and then a little bit of a quicker one. Pretty nice. Good. Okay, so what we'll do is we'll sit you up again, facing over here. And then just kind of move that neck around, move that jaw around, and tell me how everything feels.
Good. Like, what do you think? It goes, is it okay that it goes out that far?
Yeah, so it's a little bit of excessive motion. Okay. So what happens sometimes is the other side gets kind of stuck. Like that's why we had to try twice on the right side. When that right side gets stuck, it's not moving properly. So your body is trying to find some strategy to get the jaw open.
So this is the side that's stuck.
Yeah, and so that's like more of the problem side. So what we tend to see that is when one side stops moving, the other side starts to move excessively to make up for it. So as you're trying to open your jaw, the right side is beginning the movement, the left side's not participating, and your right side's kind of kicking out and doing all these tricks to try and just get your jaw open, right? Because you still need to be able to eat, talk, right? And so it's a strategy that your body's using. As we start to get better movement through that right side, then the left side's going to stop moving excessively.
I feel it.
Yeah, might be a little bit sore from that one.
Okay. Yeah. I feel really good though. And the low back or whatever yeah,
your tailbone, like your sacrum between your two hips, was just super, super stuck.
Okay.
And when that's stuck, there's not a lot of motion that happens there.
Right.
Like very little because you have very thick, strong ligaments, but there's still some. And if we're not getting the right motion there, that force transfers up into the low back and starts to irritate all the structures and tissues in the low back. And then how about the hip? How's that hip feel?
Yeah. Oh, feels good.
Better?
Yeah.
Good.
Yeah. I feel like energy in my head.
Yeah. Good.
Thank you.
You're welcome. You're welcome. Happy to help. There's one more thing I wanted to show you, which is just an easy little exercise you can do to help with your jaw. Yeah. So what you want to do is press your tongue to the roof of your mouth. Okay. And then you're going to very slowly open up your jaw as wide as you can, keeping the tongue stuck to the roof of your mouth. It's pretty difficult. So sometimes what helps me is to just touch my jaw with my hand. As you open, you want to really open, but don't use your hand to open it, just use your jaw muscles. Okay. Yeah. So do that a couple times for me. What you should start to feel is almost like an opening pressure in your jaw. Over there. And you may feel these deep muscles in your throat start to kick on that you haven't used in a while.
Deep throat muscles.
Yeah.
Sorry.
You're okay. Pause.
Yeah, it's like ethics now.
But you can do that, 10, 20, 30 reps at a time. Okay. What it does is it kind of retrains. There's a little cartilaginous disc in the jaw. And when you open the jaw, first the jaw starts to rotate and then it slides forward with that disc. And the bone and the disc are supposed to slide together and slide back together. Sometimes they get out of sync, and this exercise helps focus on the rotation so that when you enter into that translation phase, the disc and the jaw are in better sync. So if you repeat that, keeping that tongue on the roof of the mouth, it helps train the muscles that help the jaw move normally, and you'll start to notice a reduction in this as well.
So just do every day?
Yeah, something that you can take home with it. I mean, you don't have to do it every day, but maybe in the beginning, doing it every day is a good start.
Okay.
Especially if you notice excessive like movement, or if this starts to click and pop on you, start doing that and you should notice that reduce.
Awesome.
Sound good?
Yeah.
Okay.
I feel
All right.